Well, this is Dr. Sanjay Shah. I want to talk to you about regenerative medicine. Today we're going to talk about the shoulder joint. The shoulder joint is a complicated joint. There's a lot of ligaments, there's a lot of muscles. They have the rotator cuff tendons. You may have heard of rotator cuff tears or a labral tear. These are all things that can happen. These are all elements that surround the whole shoulder joint and allow its amazing mobility and its multi-use function. What I mean by that is, if you think about your shoulder joint and the way it moves, you can go inside and outside. Obviously, you can extend all the way. You can go back all the way. You can go out all the way, forward, backward, and every position in between. So it's amazing flexibility, but to allow that, you're going to have a lot of different muscles in the front, on the top, on the back, that then connect to this bone right here, the humerus bone. But also to allow that mobility, you need to have a lot of tendons, and then these tendons connect to the muscles and allow each muscle to engage a little bit or a lot, depending on the movement that you want to proceed with. Now, when all of that happens and you use your shoulder on a daily basis and you have a lot of different forces, different angles, it's oftentimes there's a lot of tears that can occur, and often in the rotator cuff tendons. So these tendons, you can see on top, they're depicted in purple. They're in the front, they're in the back, at the shoulder, and there's also ligaments that appear that connect bones to bones. When you do have a tear in a rotator cuff tendon, oftentimes you'll be prescribed a course of physical therapy, maybe a steroid injection. That'll take away the inflammation, that'll make you feel better for a few months. But how do you actually repair that tendon? Sometimes your body does a little bit of a repair, but you're left with some tendinosis, or sometimes you just can't repair it at all because the tear is severe enough where your body just is not able to repair that tendon. In this case, an option that you have are platelets and stem cells, depending on the extent of the tearing. And what we can do is actually inject platelets or inject stem cells into the rotator cuff tendons, into the joint, into this joint on top, and that'll take away the inflammation around the joint. That'll help repair the rotator cuff tendons and hopefully stabilize your joint enough where you're not experiencing pain and you can have full function and use of your shoulder. So there's a lot of different things that we can do by using platelets and stem cells. We can even inject the joint if you have a frozen shoulder, really distend that whole joint and break up a lot of adhesions. Lots of different options that you have, and fortunately we have this as an option without using scalpels and just using needles to help facilitate pain relief and function.